Hi everybody, this is Pavithra, psychologist at Idea Clinic. Today we are joined by Dr. Elizabeth, who is here to talk to us about depression. So she wants to discuss a case. So shall we start? Hi Elizabeth ma'am, how are you?
Hello Pavithra, nice to meet you. I am also working at Idea Clinics. Today I would like to discuss regarding a case I had seen recently.
So yes ma'am, please tell me about the case. Is it something related to psychology?
Yes, this is regarding a 32-year-old female who consulted me with constant headache and mild body pains with shoulder pains and backache. I did put her on certain mild analgesics, but I feel there's a deeper issue to it.
So can you tell me a little more about this patient of yours? Where does she work? What does she do and other such details?
As I told you earlier, she is a 32-year software professional. She's married with one kid, stays with her husband and in-laws. And she recently complains of severe body pains. She says that she has no time for anything. She has lack of interest in doing certain activities which she earlier enjoyed doing, and one of her relatives told her that you might be suffering from depression. Is that so?
So you are right, she is showing some signs of depression, but unless she is asked, she is treated by a diagnostic person, we cannot define it as depression. Some common signs of depression include feeling sad, having no motivation, feeling lack of energy, there's no concentration, inability to focus. So in case she has all these problems, I would suggest she comes and meets a professional with whom she can seek help.
She told me that she has some of these symptoms. So how do we diagnose depression?
So there are some tests, some standardized tests available with psychologists and psychiatrists who will do a formal assessment and then see if she has depression or she just has certain traits of depression. In case she has depression, she will be given a treatment along with therapy. In case she doesn't need medication, then only therapy can help. There are some things that she can try on her own. I'm sure she would have googled something.
Now, is there anything she can do before she meets a specialist? Because you know, nowadays it's a big social stigma and it's a taboo to meet a psychologist or a psychiatrist to that matter. So anything, and she has probably googled everything she could to know more about depression, to know whether she has been suffering from these symptoms. So is there anything that I can do at my level to help her out?
Yes, you are right ma'am. With Google today everybody has a lot of answers, but they don't know which to do and which not to do. So I would give you some tips that you can tell your patient. It may or may not help her. So some things she can try is exercise. As you keep your physical body fit, there comes a necessity for your mind also to be fit. So engaging in any form of exercise can help in relaxing the mind and the body. Next thing I would suggest is surround yourself with optimistic people who make you happy, be it your family, be it your friends, be it your colleagues. Be with people who make you happy. Then always make sure at least once in a day spend some quality time with family, either a meal together or an outing, some activity that you involve in with your family members. The next thing that she can learn to do is try to look at the positives of every situation. Any situation that you are in, there is always a positive side, so try focusing on the positives. One more thing I would suggest is keeping certain activities which happen every day without change. In case she likes watching TV, let her watch TV every day without fail. The last and the very important thing, don't stay alone. Always make sure you are with people, you're surrounded by people. Whether you like it or not, push yourself to be with people.
Pavithra, thank you so much for giving me an outline of what I should do. I will surely tell her this, and if she still complains of those symptoms and that they do persist, I will refer her to you.
Thank you so much ma'am. Glad I could be of help. Depression is a common thing and many of us are confused whether we are sad or depressed. So in case you're going through these confusions, do come to Idea Clinics. Me and my team of doctors are there to help you. You can check us out at www.ideaclinics.com. You can also call us to book an appointment to come and meet us. Thank you.